It's now my pleasure to introduce David Elise, who is the coordinator and community organizer for the Rhode Island Interfaith Coalition. The Rhode Island Interfaith Coalition has endorsed this important bill and has really spread the word among our faith communities that are really lining up in support. So it's a pleasure to introduce and thank you for his leadership, David Elise.
Thank you, everyone. And thank you to Representative Morales and Senator Cano for introducing this legislation. My name is David Elise. I'm the director of the Rhode Island Interfaith Coalition, a coalition of various faith leaders, community activists, and advocates all over Rhode Island that are united in the belief that we need to address poverty and inequality when we see it. And in particular today, we are united in the belief that all children deserve the right to have health care. That it is a human right and not a privilege. When thinking about what to say today, I was faced with the moral implications that this even has to be a statement, that this has to be a press conference, that we have to be here to say, let's protect children. Let's give them what they should have. You know, in our sacred text that a lot of the faiths in the coalition represents, we are always taught that children are a gift from God. We hear that so loosely throughout our lives, that we need to protect children. Well, here today we have a chance to advocate for actually putting those ideas and those words into action, into an actual concrete form of love that we believe is providing all children with health care. This this legislation would help thousands of children receive vital care. Children like myself. When I was a little kid, I grew up undocumented, and I remember having this conversation with my mom a couple of years ago when I was working in Rhode Island on lead poisoning, which is disproportionately impacts communities of color. I said, Mom, you know, I'm working on lead poisoning. She's like, oh, you know what? You were lead poisoned when you were a kid. And I was like, really? What did the doctor say? And she said, well, I didn't take you to the doctor because we were undocumented. And my story is not very unique. Many, many children, many families don't go to receive services because they don't have the coverage that they need because of their immigration status. And if I can leave you with anything, it's knowing that if our sacred texts are right, and if our moral beliefs are right, that all children are protected, that all children are for God, then we need to pass this legislation. Thank you very much.